Hello, I'm Dr. Sanket Mehta. I'm a surgical oncologist from SSO Cancer Center and I specialize in cancers of the gastrointestinal tract, liver, and abdominal cavity. If you have ever been told that you need surgery, you may have heard different types of surgeries like open surgery, laparoscopic surgery, or robotic surgery. It's natural to wonder which one is better and which one is the right one for you. In this video, I'll explain each approach, how they compare, and how we choose the safest and the most effective option for each patient. Let's start with what we have traditionally used, open surgery. This involves making a larger incision to directly access the area being operated on. It gives the surgeon full visibility and room to work with his hands. Open surgery is still very important, especially for large or complex tumors or when we need to work in multiple areas during the same procedure. Yes, it usually means a longer recovery and more post-operative pain, but in some cases, it's simply the safest and the most efficient choice. Laparoscopic surgery, also known as keyhole surgery, uses several small incisions instead of one large one. We insert a camera and long instruments through these incisions and perform the operation by watching the inside of the body on a screen. Laparoscopic surgery offers many benefits. Smaller cuts means lesser pain, shorter hospital stay, faster recovery, and usually fewer complications like infection. It does have some limitations though, especially in very large tumors or areas that are difficult to reach. Robotic surgery takes laparoscopic surgery a step further. Here, the surgeon sits on a console and controls the instruments, but does so using robotic arms that translate the hand movements into more precise, flexible movements inside the body. The 3D camera and improved control allow us to operate in tight spaces with high precision, which is particularly helpful in certain procedures like prostate cancer surgery and partial nephrectomies. But robotic systems are expensive, and not all procedures actually need that level of precision. So while it's a great tool, it's not automatically better. It's about using it where it genuinely adds value. Choosing the surgical approach depends on multiple factors. We look at the type and size of the tumor, where it is inside the body, the patient's overall health and fitness, whether this is the first surgery or a reoperation, and of course the surgeon's experience with each technique. For example, a small colon tumor may be perfect for a laparoscopic or robotic surgery, but a large liver tumor close to a major blood vessel may be safer with open surgery. There is no one-size-fits-all answer. We tailor it to what's safest and most effective in your specific situation. So let's do a quick summary of the key points. Open surgery, it offers full access, ideal for large, complex or difficult to reach tumors, but involves a longer recovery and a larger incision. Laparoscopic surgery, minimal invasive, smaller cuts, faster healing, excellent for many gastrointestinal and liver surgeries, however, can be limited in very deep, bulky or highly complex tumors. Robotic surgery provides excellent precision and visualization, especially in tight spaces, helps with fine dissection in certain cancers, but is expensive and not always necessary or superior to other approaches. What matters most is not which technique sounds most advanced, but which technique ensures the best oncological outcome in the disease. Laparoscopic or robotic surgery is a means to achieve surgery. It's not the goal. The goal of surgery is complete and safe removal of the cancer with the lowest risk of recurrence and the best possible outcomes. If that can be best achieved through open surgery, then open surgery is absolutely the right choice. If the same oncological clearance can be achieved safely through a minimal invasive approach like laparoscopic or robotic, then that option offers additional benefit in terms of recovery and comfort. If you're planning for cancer surgery, it's absolutely okay and important to ask about these questions. A good surgical plan should always prioritize your safety, complete oncological clearance, recovery, and long-term outcome, not just the newest technology. Also, when considering minimal invasive options, it is wise to inquire about the surgeon's proficiency and experience in these techniques. Experience matters greatly, and not every case is suitable for every approach. I hope this video helped you understand the differences between open, laparoscopic, and robotic surgery, and what truly matters in choosing the right surgical plan. If it did, feel free to like, share, or subscribe and explore more patient-focused videos on cancer and surgical care. Thank you for watching. I am Dr. Sanket Mehta from SSO Cancer Center.